Welcome, everybody. Thank you for being here. Thank you for joining us for this panel discussion about the end of medicine. My name is Caitlin Morrison, and I am a giving specialist with CCS. I'd like to start by thanking our panelists for being here. We know that you lead very busy lives, and it's a testament to your passion for creating change in the world that you've taken the time out of your schedules to be here today and discuss this very important film. I think I speak for everyone here when I say we're very happy you're here and we are big fans of your work. Also, I'd like to thank everyone who is joining us here today. I know your time is very valuable also, and I hope that you leave here today thinking that it was very well spent. What can I say about the end of medicine? If you've already seen the film, you probably have many feelings about it. I know that I personally experienced moments of anger, worry, shock, thank goodness, hope. I admit there were a few moments where I had to pause the video, sit in my feelings for a minute, compose my thoughts before jumping back in. I'm not a professional film critic, but I will say that if you didn't have a powerfully emotional response to this film, then you probably don't have any feelings. At its core, the end of medicine is a warning. It's a look at where things are headed if we maintain our current practices. That's why we at CCS were so eager to host this event, because as an organization, at our core, we exist to expose the way human mistreatment of animals ends up harming human health. And we exist to find realistic, effective, collaborative ways to create systemic change. We've just had our birthday. At 2 years old, we've already helped encourage policy change in Europe and the US. We've held the first ever investors summit in non-animal testing technologies. We've opened membership to a multi-industry coalition dedicated to changing medical research, biomedical research, and we've created public awareness about the harsh realities of animal testing and the benefits of doing things differently. And we're just getting started. Later, we're going to give you a glimpse of what the future looks like for CCS. We're excited about it, and I hope that you will be too. I hope that you will be excited enough to chip in, because everything we do relies on support from you and from supporters like you. If you do want to help, today is the day to do it, as we've received a pledge from an anonymous and very generous donor to match anything that is donated today up to our goal of $5,000. And another bonus, a big one, if you ask me, if you donate $50 or more, you'll be eligible to win a breathtaking painting by our own Dr. Akhtar. We'll give you a peek at this a little later on. In a moment, I'm going to play the trailer for the end of medicine, and we'll get right to the discussion that you're here to see. While the trailer plays, anyone who has already seen the film and doesn't need a recap should spend that time making a quick donation. There are a lot of different ways to do it. You can click a link that is in the chat. You can use the handy QR code that is on your screen, masquerading as a panelist, or you can text CCS22 to 44-321, and you will get a link to donate right on your phone. We are using all of the modern technologies for donations today, and you can take your pick of the one that you'd like to use. Thank you in advance, and please enjoy the rest of the event. We can play that trailer right now.
As soon as I was old enough to understand there was a job that was involving helping animals, that was the career for me. As soon as I could speak, I wanted to be a vet.
The deadly strain is passed on from chickens.
But first, the latest on the swine flu epidemic.
The more I went on, the more I struggled with a sort of concern that I was facilitating something which would be potentially very dangerous to human health further down the line.
You know, with coronavirus, we are being told to socially distance, and rightfully so. But we're doing the absolute opposite with these animals in these farms. We're crowding them into as tight of a space as we can.
When you look at the root cause of these infections.
Coronavirus, right? Kung flu.
We should also look in our own back garden and just look at how we are treating animals here.
We have the new pandemic already emerging because of antibiotic resistance, because of the way that we've kept animals for all of these years.
Antimicrobial resistance will kill us before climate change, and we need everyone to understand that.
The lives of voters are really put to the back burner, and the lives of those lobbyists have controlled these important decisions that are impacting our kitchen tables every day.
I just want to share my story, and I want people to know what I've learned about disease.
Greetings, everybody. What a powerful trailer. My goodness. My name is Zahir Nali. I'm the Chief Science Officer at CCS, and I'll be facilitating the conversation today. If you are joining us right now at the Center for Contemporary Sciences, we are hosting a panel discussion to discuss a recent movie, this documentary that came a month or so ago, The End of Medicine. We have an exceptional panel with us today. We have the director of the movie himself, Mr. Alex Lockwood. Alex is a BAFTA award-winning director of 73 Cows. Keegan Kuhn is here, another luminary in the space, and an award-winning documentary filmmaker, director and producer of Cowspiracy and What the Health, very clever title. Dr. Alice Brough is here with us as well, and she told her story in that documentary so beautifully, and you will hear from Alice directly about her plight in addition and thoughts throughout this conversation. And also we are joined, of course, by Dr. Aysha Akhtar, who is the CEO and co-founder of CCS and was featured in the documentary as well. I am partial to Dr. Akhtar because of her CCS affiliation, but after watching this movie, I am partial to everybody on this panel for the incredible value you created in this world. We want this to be conversational. I will be just facilitating the conversation. In the first segment, we will try to get a feel of the genesis of this documentary, the motivation, the reasoning, how this came about. In this next segment, we will maybe delve into very complex issues that the movie treated so beautifully, like infections, pandemics, antibiotic resistance, sustainability issues, as well as related matters of social justice and the like. So please feel free to jump in at any time if you have clarifying questions. We will have questions from the audience as well, and we will try to get to all of them in the last segment of this conversation. So welcome, panelists. Welcome, everybody. Can you all see me and hear me well? Perfect.
Yeah.
Alex, let me start with you. How did you and Keegan came together for this? How did that whole thing started, really? Set this up for us.
Yeah, so me and Keegan had been talking for a little while about making a film, but we couldn't settle on an idea. And then Keegan said, you know, have you ever thought about making a film exploring this link between our treatment and consumption of animals with these existential human health threats that are emerging as a result of that treatment? And I just didn't really have a clue what he was talking about. I was like, I don't know any of this stuff. So I went away and did some research, and Keegan sent me a load of stuff. And then I just couldn't believe what I found. And it was kind of like, well, this should be common knowledge. And that was when we were both really kind of like almost frustrated that this information wasn't out there for all to kind of see and hear. So we wanted to do something that would give an overview of this topic. And obviously we started making the film before COVID-19 emerged, or at least before it was reported that it had emerged. And so when that came about, we thought, okay, so maybe our film will be irrelevant by the time that it's finished production, because everybody will be forced to start talking about these issues and thinking about them and debating them. And we're just really shocked that we're here sort of nearly 3 years later, and still the mainstream media aren't addressing these issues, and these issues certainly aren't addressed in politics. So yeah, that's the kind of the genesis of the film, really.
Thank you. We will delve more into this, and I'm gonna get the Keegan's take on this. But how did you find Alice, or did she find you, Dr. Brough? How did that?
Yeah. So basically, we'd been making the film for quite a long time. We were way more than halfway through making it, and it just felt like a collection of lots of interviews. And the more we watched, we were recommended to approach Alice by somebody else who we interviewed. And they said, you should really speak to Alice, because she's actually been involved in this industry. She's somebody who has been involved in the very industry that she's now being critical of. And it was when we kind of interviewed Alice that the film sort of fell into place, because Alice's story provided that sort of through line, that arc that we could hang all the other points off, so that it didn't just feel all these different points just hanging out in the ether, and that we had this kind of emotional story that we could tie everything to. And so, yeah, Alice basically gave the film its structure, really.
Mm-hmm. Yeah, it was such a powerful. I'll come to you, Alice, in a second. Keegan, what do you have anything to add to that on the genesis itself, your experience?
Yeah, when we thought this film was going to be a warning, that, hey, there's a massive zoonotic pandemic that's coming, and that antibiotics are failing, and yet here we found ourselves in the middle of a global pandemic caused by our use and abuse of animals. So it definitely reshaped the film. The use of Alice as our protagonist throughout the film was really important to us. Joaquin Phoenix and Rooney Mara came on pretty early on this project as executive producers, and they felt the same way. They saw the first edit and they were like, Alice is the star of this film. Like, she is the story that we need to follow. And I think it works really well. Alice works as a guide too for this project. So, you can come into this film not knowing anything about the subject matter, and Alice kind of holds your hand throughout the whole project or through the whole film to get you to the end point.
So Alice, tell us your experience then. I know there are so many poignant moments for you throughout the documentary. I mean, what I wanted to ask you is, did this happen gradually for you, or there was a time when you said, I'm done with this? I mean, there's a time in the movie where you were at a farm and your eyes became red and you were distraught and you left. So has this experience to speak out came with an incident, or has this been a slow grind for you?
I think it was a bit of a slow grind. I mean, I worked in the pig industry for about 4 years, and kind of halfway through that I went vegan myself. So at that point I was starting to put all the pieces together. And then at about 4 years I was just like, I've seen the same thing on every farm, all these horrendous disease issues. I'm pumping antibiotics into every farm because they're not being looked after correctly. Horrendous welfare issues. It's just like I tried my best while I was in the industry to do something about it from within. I thought maybe that would be the most effective way, but it really wasn't. Like, the system is so fixed in place that I just thought, I'm going to have to start telling whoever will listen to me about this whole tale. And there's so many issues interlinked that any opportunity has been great.
And at a great risk, you jumped into the unknown, right? You essentially you took on a powerful industry and you didn't have a path forward, basically.
Yeah, pretty much.
Is that fair? Fair statement?
That's about right. But I think the alternative of just walking away would have been much, much worse for me, just in terms of my, mentally.
I know we'll come back to that point. I know Aysha, Dr. Akhtar has been talking about these issues pretty much her entire life. I think I've known her for a year now, and I know about her for 10 years. But I think these issues about pandemics and danger, and I think she has been raising this for a long time. And Aysha, one thing you that struck me really in the documentary is, and I'd like to quote you here so that I don't put words in your mouth. Not once, and you worked in government, not once we talked about how these emerging diseases came into place. End quote. You were describing the pandemics and that, in all these meetings in government. Not once, and I find this shocking. Can you just recalibrate this for us? How isn't the role of governments to talk specifically about these issues?
Yeah, well, so that was I was referring to my experience. I worked for, I don't know, 6-7 years in the Office of Counterterrorism and Emerging Threats of the Food and Drug Administration. So we were preparing for threats that could be like use of biological weapons or naturally emerging infectious diseases that can cause pandemics. And so I worked with the Food and Drug Administration. We were stockpiling medications, vaccines in the Strategic National Stockpile. I worked with the CDC, the NIH, the military, Department of Homeland Security. I mean, just so many entities. And that's when I say not once, all we did was talk about, if this comes about, what do we need as far as medicines? And so what vaccines do we need to stockpile? What drugs do we need to think about? But we never once talked about how to prevent these things from happening in the first place, at least as far as like these naturally emerging infectious diseases. And that was really disheartening. And and just going back to what Alex said, I thought when this pandemic hit, I thought, okay, now finally, the world is finally going to wake up and realize this deep, profound connection between the risk to human health and well-being with the treatment of animals and their well-being. But it didn't happen. And it's incredibly frustrating. But yeah, government should be. And I think, honestly, if I would say that our public health agencies, our governmental agencies, most of them, there's some exceptions there within our government, individuals who are trying to make some changes. But for the most part, I would say that it's been criminal on their part, on the fact that they have done pretty much nothing to prevent the next pandemic. And unfortunately, we will have another pandemic, as the movie really kind of showcases. The threats are still there, the risks are still there.
So is our policy reactionary when it comes to government work, or there's no vision on how to prevent, how to put things in place, how to anticipate the next disaster, next catastrophe? I mean, is that really what's happening out there?
I think Alice will say the same. Our policy is always reactionary. It's not prevention. I mean, that's how we address so many things in the US and elsewhere. It's not about prevention. Prevention takes more time. It takes more thought. And in this regard, it takes an acknowledgement of, yes, we are treating animals badly. And that is not something that a lot of entities, a lot of countries, a lot of agencies, a lot of individuals want to acknowledge.
Incredible. We will delve into the next segments when it comes to infectious diseases more, Dr. Akhtar. Keegan or Alex, I want to just shed light on the role of Rooney Mara and Joaquin Phoenix, because celebrities and influencers like that can bring awareness to these issues. Clearly, we are talking about a challenge here, which is, no change is happening materially. We still think the same way. Maybe once, we are over this in 2 years, maybe we'll go back to the way things were done before. So the celebrity factor here, clearly these are committed individuals who are trying to do the public good and advance betterness of humanity. How did they come on board? How did you? And is there any future for additional work like that as a movement? Alex or Keegan, maybe.
Well, I'll go ahead and answer then. Yeah, we had started working on the film summer of 2019. COVID hit, and we had been on production about 6 months, and we did a press release about this project. And Joaquin reached out. He had been an executive producer on What the Health, and said, "Hey, Rooney and I are actually in pre-production on a project just like this. We thought, hey, we need to get the word out." And so we said, "Hey, is there a way we can work together?" And they said, "Hey, you guys are already 6 months ahead. Let's join forces." And so they came on as executive producers pretty early on in the project and gave their input. And a big reason for that and their involvement is that, yeah, they realize that they have credibility and a celebrity status. And so attaching themselves to a project like this helps elevate it. And it absolutely has. People have paid attention to the film because they see, Academy Award-winning actor Joaquin Phoenix and, award-winning actress Rooney Mara attached to it. And so they think, okay, well, there's something credible to this. And we've seen that really be effective. Cowspiracy, which I think would have been written off as a conspiracy film when Leonardo DiCaprio came on as an executive producer. People said, oh, this is a legitimate project. So it's definitely helped us a lot. And I think there's a lot of celebrities who are willing to associate themselves with a greater good and promoting a more compassionate, more sustainable, more health promoting way of living.
Right. Any comment? Anybody on the celebrity factor? There's another production, I think, by Kate Winslet, if I'm not mistaken, that I've seen last year. Very powerful documentary as well. So it looks like there is a critical mass that of individuals who are visionary on this, who are trying to bring their weight and knowledge and resources, quite frankly, to move this forward, perhaps as a movement. So we salute them all. Any comment from Aysha and or Alice on this as well? You like more celebrities to join?
We would like more celebrities to join, and it's not because celebrities have the know-how that necessarily others do, or it's really about influence, like you said. And so if the more celebrities are involved with many things, the more potential for influence an event or a film like this can have. So I say the more the merrier.
Greater awareness. If someone has 100 million follower or 30 million followers, I mean, the message will spread quite rapidly, instantaneously. So this is what, Dr. Akhtar, what about? I'm going to come to additional issues. For example, here, one of the most poignant thing for me was the statement, the remark by the mayor of New York City towards the end of the movie, where he said, Honorable Eric Adams, he said, and I quote him, "Right now we are dealing with sick care instead of health care." And I'd like some of the doctors to comment on this, but maybe in the next segment, because this is so profound. I mean, we are dealing with sick care, not health care in the United States, which is kind of seems astounding. Dr. Akhtar, I know you are expanding the mission of CCS, and you are trying to address these kind of issues as well. Sustainability matters, social justice. Can you tell us about the mission and its expansion a little bit?
Oh, sure. So for those of you who've been following what we've been doing here at CCS since we started 2 years ago, just at the beginning of the pandemic, a great time to start a new organization. But we've been working on replacing the use of animals in experimentation, working on policy, public awareness, and education, things like that. But we're going to be now at 2 years old, we're going to now be expanding our mission. So we're going to now be looking at a larger umbrella of sustainable health that looks at the intersection of human health with planetary health, and as well as animal protection in many different areas. So we're still going to continue the work that we have been doing in working towards replacing the use of animals in medical research, but we also think that it fits under a larger narrative now, that we cannot, as a species, keep going on the way we've been going. We cannot see other animals as just fodder for our use, because if nothing else, it shows how much it comes back to hurting us. We know that animal experimentation is very, very ineffective and incredibly flawed and misleading in medical research, and that we need to replace the use of animals, not only for their benefit, but for also human health benefit. So we know that it's the same kind of messaging, same narrative that plays a role in many issues. So we're going to be, over the next few months, redoing our website and planning our expansion into these other areas and our new programs. So just keep an eye out for the larger CCS mission and our new website in that regard.
This is wonderful. This is wonderful. Maybe Caitlin want to expand a little bit on this. Is it time for Caitlin to tell us a little bit more about how we can help?
Thank you. Thank you, Aysha, for that future glimpse of CCS. As I mentioned before, it's big news, and everybody here is excited and ready for the challenge to take on this bigger mission, because we know that this is the kind of work that can change the world for the better. I want to take a moment to thank those who have already reached into their virtual pockets to support our work. If you haven't had a chance to donate yet, now is the time to do it, because I'm talking and I have the least interesting things to say of anyone else here. Remember that anything you give is going to have double the impact today because of an anonymous supporter. And how do you get cooler than doubling the donation of anybody who makes a donation by doing it anonymously, being a total mystery. Speaking of cool, I promised to show you the painting that I mentioned by Dr. Akhtar. When I'm rich, by the way, I plan to buy all of her work from her. She doesn't know this. This is the first she's hearing about it, but it's true. Her work is so vibrant and joyful. I would smile all the time if it surrounded me. And you will too, if I can figure out how to share my screen. Let's see if I can do it. Can I? Oh, I can. Wonderful. This piece is inspired by the theme of the end of medicine, the subject, one of the world's most intelligent creatures, the noble pig. This is Josephine. The full-size canvas measures 20 inches by 20 inches. And that's for those of you who are already looking for a spot on your wall. So remember, if you want to help or you just want a chance to get that beautiful painting, there's a link in the chat. You can click the QR code that's up on the screen, or you can text CCS 22 to 4432-321. And just quickly, before we get back to the panel, a quick reminder to put your own questions for the panelists into the chat. We're keeping track and we're going to get to those very shortly. And we want to make sure that we get your questions asked and answered. Thank you very much. And we will get back to the main event now.
Thank you, Caitlin. Such a beautiful painting, I have to admit. Thank you for sharing that with us. So now let's, in this segment, delve into some of the issues that were discussed in the movies for informational and educational purposes. I mean, the way you structured this film, Keegan and Alex, and correct me if I'm wrong, is into segments, defined segments that address really complex complex issues, antibiotic resistance, a very complex topic, epidemics and pandemics, social justice and poverty issues, things related to sustainability and deforestation. And I really recommend everybody to watch this movie. I was able to get it on Amazon Prime. It took me 2 seconds to download. I don't know if where people can find it elsewhere as well. Maybe someone can speak to that. Where can people find it and purchase it or download it? But I hope we can use this 15 minutes or so to educate folks a little bit about the issues of antibiotic resistance. Why is that important? About the pandemics, how the transmission happens from animals to humans. Is it only in the bush trades? Is it only in the wet markets? Is it in farm animals? So we are going to talk a little bit about this so that folks who are not scientists out there can also get benefit out of this conversation if that is possible. And I was struck by something. Maybe we can start with antibiotic resistance, because this is a black box to many. Something that Professor Dame Sally Davis said, who was the chief medical officer, the previous chief medical officer for England, and the chief scientific advisor to the Department of Health in the UK. And I quote, "Antimicrobial resistance keeps me awake at night." I mean, this is one of the foremost experts in the world, and that's what keeps her awake at night. Can any of the doctors or the filmmakers here explain to us why antimicrobial resistance is such a threat? I mean, viewers can watch the movie to get the full scope, but why is this so important for us to understand right now?
Alice, you want to give a first go?
Sure.
Okay.
So antimicrobial resistance is important because when we reach a point where our antibiotics, our antivirals, our antifungals don't work as they should, we're not going to be able to do basic surgery. We're going to die from really simple infections like urinary tract infections and things like that. If we have a rise in things like pandemics, viral pandemics, the secondary infections will kill people, and there will be a much higher mortality rate. So the reason we've mentioned it in this context within the film is because about 75% of antibiotics worldwide are used in livestock, and they are used in ways that are very inappropriate. So massive overuse in animals that don't actually need them, misuse for diseases that are not the right profile for that antibiotic, and they're used prophylactically and for growth promotion, so at really low levels, which is like the perfect kind of condition for this resistance to arise. Using them in livestock in that quantity affects us. There have been many studies showing a direct link between that resistance developing in livestock and then becoming an issue for us and our medicines. Because you think about it, we eat these animals, we share airspace with them, we spread all their waste on our crops that we then eat. It gets into the air, it gets into the waterways, both the resistant pathogens and this ridiculous level of antibiotics that we're putting in. So there are many ways in which that is frightening, but I hope that kind of summarizes the issue sufficiently.
Yeah, I think. Yeah, no, I mean, it's something that at least public health officials have been, have been talking about for some time, but there's been very little action in that regard. Like in the United States, there's a voluntary reduction in antibiotic use at the Food and Drug Administration. It's a guidance that they put out, but it's voluntary to follow it, and it's only a guidance. There's no curtailing of the use of antibiotics in farmed animals. And as Alice said, I mean, if I were to say, if there has been one type of medicine that has transformed how we live. One type of, drug that has transformed how we live and really increased our lifespan. I mean, one would be vaccines in general for, many of the threats that we faced in the past that are no longer such big threats, and antibiotics. I mean, as Alice was saying, almost everything we do depends on antibiotics. And we are facing an era where we are not going to have antibiotics for use. I mean, so the reason why it's such a big problem is you use it, the more you use antibiotics, the more likely that the bacteria will mutate into a form in which they are resistant to that antibiotic. So then you spread what's called superbugs. You create the creation of superbugs, which are microbials, bacteria that are no longer susceptible to antibiotics. And so that's what happens. And so you've got like this double whammy in factory farms when you think about it. You've got these conditions in which the animals are trapped and kept so poorly. They're sick all the time, just from the nature of the situation in these factory farms. And then you're feeding them, pumping antibiotic after antibiotic. And what that does is that really spurs this creation of bacteria that's resistant to the antibiotics. And so we're going to have drugs at some point that we can no longer use. And that's truly, truly scary, especially if we're looking at pandemics, because often people don't die from the viral infection in pandemics. People die and succumb to superimposed bacterial infections. And so even for pandemics, which are viral in nature, we need antibiotics because we need antibiotics to treat the bacterial infections that may follow a viral infection.
Yeah. Oh, sorry. Go ahead, Alice.
I'll just add a little bit to that, because you mentioned like voluntary targets of lowering antibiotic use in livestock. Obviously, the US is quite an extreme example. 80% of your antibiotics are used in livestock. UK, we have sort of lowered our usage quite significantly to about a third, but even still, just within the 4 years that I was practicing, I saw like resistance develop in real time. So diseases I was treating with one antibiotic at the start of those 4 years, I then couldn't treat with the same one, which is really frightening. Like that's such a short period of time. And there were certainly some of us that were suffering with resistant infections ourselves, and some of those sort of diseases that I was treating were zoonotic. So it's very easy to see how this jumps and becomes a problem for humans.
Yeah, I mean, it's such a threat that Dame Sally Davis said. She said, antimicrobial resistance is going to kill us faster than climate change will. Like, I mean, it's that serious of a threat that when these drugs fail on a global scale, people will die in mass, 50 million people a year projected and more. And so this is something that, there should be alarm bells ringing around the world that, hey, this is a major, major issue that we need to address today if we want to, prevent the next mass die-off of humanity. And yet it's ignored primarily because, again, 70–80% of all antibiotics are used for livestock. So the livestock industry, who's involved in media, doesn't want this information getting out. And they also control government policies, so they don't want anything to change. That's why we see voluntary. We don't see mandated policy changes.
Yeah, and that kind of ties in with the fact that we really wanted to interview some top, high-level decision makers when it comes to policies around antibiotic use. So we tried to interview DEFRA in the United Kingdom, which is the Department for, I'll probably get this wrong, Food, Environment and Rural Affairs. And we were sort of really honest about what the film was going to be about, and that we just wanted to get their take on it and ask them some questions. And after about 7 months email exchange with them, they declined to be part of the film in any way. And I think, it's been quite telling, the number of organizations and government departments who've rejected to be a part of this film, or just to answer some questions around this, because really I think they know that there's no decent answers to the questions that we would have posed. And I think, when you try and raise the alarm about this subject, people You know, you could get away with thinking, oh, that must be kind of like some pseudoscience or some like fringe thought, just because nobody's talking about it. And people think, well, you know, if it was that serious, we'd all be talking about it. But in reality, it's that serious and no one's talking about it. So it's kind of like quite an uphill battle to try and get the message out there. And that's why, you know, I think hopefully the film will help with that in some way.
Again, thank you for shining the spotlight on this, really, because this is such an important threat that is unknown to many, even folks who follow everything in science. Alice, you mentioned, you cautioned in the movie about also not thinking that small farms are better off on this exact point. We think that small farms could be, you know, healthier, better alternatives, but that's actually not true, because they may not have the system of medical checkup and resources. As well. Can you elaborate on this as well?
Yeah, sure. Certainly small farms are a lot more variable. I had some smaller farms which were probably, you would class them as better than the factory farms I was visiting. But there was also the other end of the spectrum that was just not being monitored. They didn't have a vet on the farm for 20 years, you know, this sort of thing. They're putting whatever vaccines in they felt like, rather than any actual sort of health checking. And I remember this one farm I went to, and it was like a family farm shop. They had like 100 pigs or something and some deer, and there was like a farm shop attached. So people going in were paying a premium for like a local pork chop or whatever. And I remember I went in, all I could hear from like 500 meters down the road was just this horrendous hacking cough. And I euthanized like 5 pigs because they looked awful, like the whole lot of them looked awful. And I did a post-mortem exam, so I opened some of the cavities, and the lungs were like nothing I've ever seen on this planet. They were black with like abscesses, just like the whole set of lungs was black and abscesses throughout. And I was just like, how is this legal, and how is this something that people are paying a premium for, thinking they're getting like a high quality product? This is probably making people sick. Like yeah, so real variation. Obviously the factory farm end of the spectrum, you're getting a lot more like mass medication, where you get the problems with treating animals that aren't sick, and growth promotion levels and stuff like that. Yeah, not great.
Thank you for explaining that point. There is clearly a correlation between overcrowding and the way we are dealing with farm animals and antibiotic use. That's a fair statement, right? Because antibiotic will be used every now and then, but because we are overcrowding them and putting them in these high-risk environments, then there's need to increase and sustain the use of antibiotics. So now I think this is a clear point to many. Can we go into the other subject of how viruses and pathogens move from animals to humans? What are not the technical details, but clearly wet markets, everybody now is aware of how transmission happen in wet markets and the unsanitary conditions and how, but there are other spaces, other areas, you know, factory farms. Aysha, Dr. Akhtar, you mentioned Ebola and HIV starting in non-human primates in the documentaries. That's the belief, and it's the combination of the bushmeat trade and the deforestation and the logging industry that is the root cause of this acquisition into human or transition into humans. Can you explain to us how that zoonotic transmission happened?
Sure. So about 3/4 of new infectious diseases are coming from other animals. And, you know, and that's what it comes down to, is the fact that we are involved in activities now in which we are increasing the interchange between humans and other species, or changing how we treat and house other species. So as far as the first one is concerned, by deforestation and factory and animal agriculture is if not the single largest cause for deforestation, we are basically bringing humans into contact with other species at a greater and greater rate. So other species are carrying many viruses, many we have never even encountered before. And so we think that the way we got Ebola and HIV was through increased contact with non-human primates and other animals through a combination of the bushmeat trade and deforestation, and initially from the logging industry, and now animal agriculture is playing a bigger role in Africa. And that led to greater transmission of the virus to humans. And then we got HIV and Ebola that way. The other way is how we treat animals and domestic, and here I'm talking about domesticated animals. So factory farming is, when we think about factory farming, what the threat we're really thinking about is an influenza A virus. And I know most people hear influenza and they think, that's no big deal. That's the flu we get every year. But that's not what we're talking about when we're talking about a pandemic type of virus. So here's how it works. Actually, we believe that all influenza A viruses begin in wild aquatic birds like geese and duck, but we rarely get sick, very rarely get sick from direct contact with those animals. So something has to happen to the virus to turn it from a low threat to a high threat. And that's where factory farms come in. So studies have shown that influenza viruses easily and frequently enter factory farms. And once they do, they transform what's called from a very low pathogenic, low threat, low risk, to a highly pathogenic. So you might have heard of highly pathogenic avian influenza, bird flus. We have one spreading amok among factory farms in the US now, in the UK, and other parts of the world now. We have our own epidemic with highly pathogenic avian influenza. So because of the conditions in factory farms, because you have animals who are so stressed and distressed, their immune systems are down. Like when we're stressed, it's easier for us to catch a cold. Our immune systems go down. So you have that in combination with the fact that animals are so tightly packed, it makes it very easy for the virus to spread from one animal to another and spread like wildfire. And each time the virus gets into another animal, it has the potential to mutate into a new form. And so we have viruses mutating constantly now in factory farms. We've seen the mutation rate of influenza viruses dramatically increase over the past few decades in factory farms. So it's just a matter of time before one mutates into a form that will not only be highly lethal among humans, but highly transmissible among humans as well. So it's very likely that the next pandemic will come from a factory farm.
And could I just say, I was just going to say on that, but it was something we really wanted to make clear in the film, that when we looked at sort of SARS, Ebola, COVID, in the way that they were reported, there was always lots of kind of almost racist undertones, and we saw a lot of racism cropping up, and look at what they're doing in these parts of the world. Aren't they savage? Aren't they, this and that? So we wanted to make it really clear that actually the behaviors that we're criticizing are behaviors that we're partaking in the Western world, and in the film we make a lot of comparisons between, say, wet markets and factory farms, and we talk about the similarities, of which there are plenty, and they have the potential to be just as dangerous, if not more so.
Yeah, and I'd like to add to that too, is that people, going back to the previous question about small scale, in the United States, organic certification for animal products, animals aren't allowed to have antibiotics. And so what you're seeing, and I've actually interviewed a dairy farmer, organic dairy farmer, who talked about this. You have animals who are suffering with infections who are going untreated because those animals would then have to come out of production. And so you'll have respiratory infections, for example, in dairy cows, or mastitis in dairy cows, who go completely untreated because the farmer would lose money. And so you'll have an entire herd. And again, these are, small scale, several thousand animals versus hundreds of thousands of animals, and organic. And so people think that this is like, oh, this is safe, and they're not giving antibiotics so that we don't have to worry about the antibiotic resistant threat, but they're still posing a zoonotic threat because these animals, again, are suffering from chronic infections that could then, jump that species barriers into humanity. So it's beyond just factory farming. It's any sort of messing with animals that's posing a threat.
Right.
So last point on that, the avian influenza situation at the moment in US and UK, I think we have the worst season on record for avian influenza at the moment in the UK. Like, we're slaughtering herds left, right, centre, flocks. And it's something that is still seen as low risk to humans, despite the fact that we've had a spillover event already this season. Swine influenza was something that I was seeing a lot of as well. It's not notifiable, so you don't legally, if you suspect it, you don't have to test for it, you don't have to notify anyone about it. I saw it pass between, members of staff and pigs very frequently. Saw it pass to the vets to be taken home to the family, all these very worrying things. And the fact that the pig is like the perfect mixing vessel for both avian and human strains of flu. So the fact that we're, in these barns with these pigs breathing in all their respiratory secretions, all the influenza, birds are coming in and out the barns. It's like a recipe for disaster. And as Alex said, we absolutely can't point the finger at anyone else, because that's exactly the same issue that's in wet markets. And it's going back to Aysha's point at the start about reactionary policy instead of proactive. The UK government realised that there is an issue with influenza to the point where they've created a document to suggest how to deal with the excess 750,000 deaths they predict from a swine flu or an influenza pandemic. Rather than creating a document on how to prevent that situation arising, they've decided, how are we going to deal with all these dead bodies? So that's pretty frightening, I would say.
Incredible. All these are such important points, and I think the viewers and listeners, to many, this is new information that many in the public actually do not know. I consider myself someone who follows, and I have soy in my fridge, and I drink soy milk. And doing prep for this, I came across numbers that only 1/5 of the soy production, and some statistics put it at 1/10, goes to human consumption, but the rest goes to feed, and that is one of the key drivers for deforestation. So to make more land so that we can feed animals, so that they can feed us, and that is causing a lot of the issues here. I don't think many people know that only 10% or 20% of soy, and not soy as an example, but there are other feed material that are actually raised to feed animals and farm animals and not humans.
I'd love to talk about that. About 50% of all of the grain, soy in particular, that's grown in Amazonia is exported to Europe to feed livestock. So when we talk about like deforestation around the world, particularly in the Amazon basin, there has been entire campaigns about soy, and that soy is destroying the rainforest, ignoring the fact that 90% of the soy grown in the Amazon basin is going to feed livestock, both in South America and in Europe, and some in the United States as well. 90% of all the corn grown in the United States goes to non-human animals, and that corn is destroying entire ecosystems to grow a crop that human beings aren't even eating.
Right.
And this is everywhere around the world, that when we look at the primary cause of deforestation, environmental destruction, it's animal agriculture is at the forefront. I live in the Southwest United States, and we suffer from, unprecedented droughts. We're in the worst drought in 5,800 years. Rivers are dropping dramatically, and everyone's talking about how cities are using water, ignoring the fact that 50 to 70% of all the water in my state and the surrounding states goes to feed animal agriculture, primarily irrigating alfalfa fields, which again is a crop that human beings don't eat. And so this is a major issue. When we talk about climate change, we talk about pandemics, we talk about antimicrobial resistance. It all comes back to the same source, and then that's us messing with non-human animals.
Right.
I think the statistic is that animal agriculture, the feed crops especially, is the single largest use of land by humans, if I read that correctly. When you think about it, it's
28% of
28.
the entire land mass is for livestock, whereas urban, like human living percentage is 1% of the world's land surface. So
Incredible.
That's amazing. It's such an inefficient process.
Incredible. Incredible. And they are diseased. It's not just that we are getting good food on the table. We are getting contaminated food on the table because of these the methods we are using also. Can we touch? I mean, I do not want to close this. I can talk for 4 hours here, but we have to at some point stop and take questions. Can we talk about a very heavy topic, the issue of poverty and social justice that you touched on in the film as well? Everything is interconnected, and the exploitation of low-income neighborhoods. And can anyone care about commenting on this briefly without going into the politics of it too much?
Yeah, I mean, I'm happy to talk about it. In the United States, the Southeast is predominantly African-American, historically African-American population. And that's where we see the highest concentration of CAFOs, concentrated animal feeding operations, factory pig farms, factory poultry farms, chicken and turkey predominantly. And the term that's being used, and it's used in the film, is environmental racism, because these operations are set up intentionally in communities of color, in Black and Indigenous and Latino communities, because the industry sees those people as underrepresented in government, disillusioned with government, or disempowered entirely. And so they lack the ability to fight when these polluting industry shows up in their communities. Because if you were to put a factory pig farm in a affluent white neighborhood in North Carolina, Southeast United States, there'd be uproar and it would never happen. But you can do the same thing in an impoverished Black community because of the legacy of racism in the United States and the institutionalized racism and disenfranchisement with government for people of color in the United States. So, and this is everywhere around the world, though, is that any colonized people are suffering from the same sort of thing, that these polluting industries say, hey, we can exploit impoverished people, and particularly people of color, because that's what we've always done. And that's something that we wanted to do with this film, is to shine a light on the fact that institutionalized racism is feeding and breeding these pandemics. It's all interconnected. Yeah.
And I was just going to say on that, one of the arguments often used against vegans is, why are you focusing on animal injustice and you're not focusing on human injustice, racial injustice? And what we're trying to say in particularly this segment of the film is actually they're so interconnected. It's one and the same. It's not like they're two separate entities. One leads to the other. And we had the privilege of interviewing in the film Elsie Herring, who's been campaigning basically her whole life about the pollution coming from the factory farms in North Carolina, where she lives. And she was saying in her interview, I can't remember whether we included it in the film, but she said basically everybody along this road gets cancer early, gets this early, and has a short shelf life and dies way before their time. And she actually passed away literally about 4 or 5 weeks after we interviewed her. And whilst we can't say, for sure, this was linked to the CAFO, which was literally 100 meters from her house, it just seems a huge coincidence. And so, we really wanted to raise this in the film, because it's something that people don't often think about, that link between animal agriculture and human injustice.
Well said. Yeah, Alice, perhaps have something.
Go on from that. Sorry, I'm massively preparing for debate on Sunday on this very topic, so I'll just give you some figures. When you look at the number of humans in the world, obviously there's about 8 million people. We somehow manage to feed, water and medicate 80 billion land animals every year to slaughter. So about 2 billion people lack access to antimicrobials, as we've sort of talked about before, but we're feeding 75% of those to livestock over the globe. A third of the world face water shortages, and as Keegan was saying, we are irrigating like 83% of our farmland to feed livestock with fresh water somehow, and people are starving to death, people are going thirsty and have no access to safe water. So it's a huge injustice, in fact an abomination, that we think it's okay to feed ourselves in the West on animals that are, you know, the efficiency of producing animals, sometimes ruminants, is like 30 kilos of feed to 1 kilo of edible meat, which is just mind-blowing when people are literally starving. I think 8,000 children starve to death every day, which I can't even bear to think about, knowing how we're growing animals.
And that's even on the production end. And then you think about the further exacerbation of these problems because of the environmental pollution, destruction, and climate change that happens in large part because of animal agriculture. So water, fresh water is becoming scarcer and scarcer in so many areas of the world because of climate change, global warming, and the ability to produce food on those lands is decreasing again because of the global warming and the drying of the land and less water and so on. So it's all such a vicious cycle, and it really is. It's, as Alex and Keegan and and Alice was saying, everything is so interconnected. It is so interconnected. I mean, if we could just end, I'm going to come out and say, end animal agriculture in one full swoop, we would significantly make a major impact on our threats to future pandemics. Antibiotic resistance would hardly even be an issue. Not that it won't be an issue at all, but it would hardly be an issue. We could feed so many more people. Our own health would be improved. We would lower our risk for heart disease, cancers, and so many other, diabetes and so many things. And we could save so many animals. I mean, it just makes so much sense. And it's just so hard to believe that, you think about it, there are many problems in this world that we don't know how to solve them. This is multiple problems that we know how to solve. We have the answer, and it's just a matter of if we're going to be willing to actually take the action and use those solutions.
Yeah, well said. Well said. That's a great segue to the message that each of you want to have to the public from making this movie or participating in this movie. I know Aysha just spoke eloquently about her call to action. Maybe we can go around. Keegan, maybe in a minute or so. What's your message? What's your hope going forward? I am, by the way, we are getting a lot of positive feedback. Kudos to you, etc., from everybody here who are listening. Keep up the good work. Alice, they are asking, what's the debate Alice is preparing for from JD Scene? Forgive me for butchering the name. Again, many thanks, lots of praise for all of you. So what's your message in 1 minute or so, each one?
I'll start on that. Yeah, my message is the same as Aysha. We have to end animal agriculture. It would save the climate, the animals, our health, future pandemics, alleviate many social justice issues. I mean, it is the issue that we need to address, and it's the one issue that's being ignored. So promoting a global shift to a plant-based diet, vegan lifestyle is essential, and that's what I've dedicated my life to.
Wonderful.
Yeah, the same, really. Exactly the same. We always said we would follow the data and follow what the science said when making this film. And yeah, obviously we went into this film as vegan filmmakers, but we were happy to be swayed and just go with whatever the truth was. And it's kind of unequivocally said, you know, there's really no way of consuming animals in a way that is safe. And I won't say too much, but we've had potential opportunities come up where particular people are looking to kind of endorse the film or give the film a platform. If we can just kind of temper the message a little bit, or suggest that maybe we eat less meat and that'll be better, or maybe we eat free range meat and that'll be better. But it's just not what the data suggests, and it's not what we know to be right as well on a moral basis. So yeah, it's a lot of people don't want to hear that message because it is so kind of absolute, but that is what we're saying with this film and what we believe.
Yeah, I think on that, like, less and better kind of rhetoric that we hear a lot, I think looking at the data, the reality of that would be a steak every 3 years. So, I mean, feel free, but it's not going to be a reality really for anyone on that one. I think the message for me is just to broaden it out a little bit. Any way that we exploit animals has been shown to be incredibly detrimental for us. You know, Aysha obviously mentioned the research element. We've missed out on loads of amazing medical discoveries. We've been late with stuff. We've killed a lot of people with data from animal experiments that are not transferable to human stuff. That's, you know, one way of using them. In the UK, we have a lot of sort of blood sports shooting, for which many people will burn patches of amazing ecosystem land. They will shoot any predators, birds of prey, sort of endangered species to fuel this mad obsession with hunting and shooting. Of course, animal agriculture, many people have mentioned already. But yeah, I think the focus really needs to be holistically looking at how, as humans, we are going to be able to survive and produce food. And it is not by destroying all the ecosystems that we have at the moment. We are really only a few years away from sort of hitting tipping points that beyond that, we're not going to be able to salvage ecosystems and grow food for ourselves. So I just hope that people kind of start just making these connections, looking at how it all pieces together, and how, you know, we have a lot of power. This is the one thing we have power over as a consumer, is our diet and how we choose to purchase products. You know, if we're in a position to do so, we need to be looking at our own choices. So yeah, hopefully that's what people will start to do.
I'll just
Wonderful
add,
messages. Yeah, Aysha, if you add something.
yeah. So I'll just add, in addition to everything that everyone said, there are 2 policies here in the United States that, if everyone could reach out to the representative to support. One is called Preventing Future Pandemics Act. And it's a step in the right direction, and it's co-sponsored in the Senate. I think Republicans and Democrats on that one. It would ban the sale and consumption of wild animals in the United States. And as I mentioned, it's a step in the right direction. It's not the end all to it all. Another one is called the Farm Reform Act. And that one would put a moratorium on the largest factory farms, confined animal feeding operations, and then phase out the largest ones in the United States by 2040. And again, it's not the only answer. It's not all the answer, but it's a step in the right direction. And so I think Sarah from CCS shared a link to the action plan with the information about those 2 bills. So you can just go onto the link and start helping voicing your support for those 2 bills.
These are all wonderful, wonderful messages, and we hope that you all can take actions, whether it's through lifestyle or through, you know, this type of advocacy work, or by donating to CCS or to the movie, or anyone in this sphere of thinking. I'll hand it over to Caitlin. I did learn a lot today, and kudos to you for everything you are doing. You did a huge favor to this universe by producing this kind of work. And I can't wait till your next project come on. And so I'm going to sign off. Thank you so much. Yes.
Hey, I'm sorry, just real quick.
Yeah.
Can Alex, do you mind just telling everyone if they haven't seen the film, how they can see the film?
Yeah.
Yes. So in the US, everyone can go onto Apple TV and download the film. You can watch it on Amazon. You can watch it on iTunes, which I think is the same as Apple TV. You can watch it on YouTube, YouTube Play, I think it's called. No, Google Play, YouTube Store. I'm trying to think of there's a whole load of places. You know, if you live in the US, you basically can't move for places you can watch the film. But in other parts of the world, people just have to wait a little bit longer because we're still sort of working on releasing internationally.
Someone asked about Canada. Any idea when it will be available in Canada?
Yeah, I think it's available now. I think it's Keegan, am I wrong in that?
Yeah, the US and United States and Canada, it's available. And if you go to theendofmedicine.com, that has links to all the places you can see it in North America currently. And then hopefully, we'll have global distribution. People are watching it in other parts of the world using VPNs, hiding their IP address, and then you can get around the global blocks. So we are hearing from people from around the world who are watching the film on iTunes, and we really appreciate everyone who is watching it and spreading the information, because that's the whole reason why we make this, is to get this information out to as many people as possible. And Zahir, thank you so much for the kind words. We obviously, though, could not have made this film if it wasn't for people like Alice and like Aysha for their incredible work and their contributions. And so we feel incredibly indebted to all the researchers and all the people who have been sounding this alarm for so long, for decades. And we're just coming along to try and amplify their voices.
That's wonderful. I read, was it Variety magazine, Alex, that gave early Oscar predictions for 2022 or 23. And named this film as a nominee for Best Oscar in Documentary. So that's amazing. So we just got to get more people to watch it. So please, everyone, just share it on Facebook, share it on your social media, show it to your families. Please show this film.
Wonderful. Thank you, everybody. Caitlin, maybe you can close us out here and give us some updates on the fundraising process. This has been really, really enjoyable, and again, wonderful panel, and kudos to all of you. Thank you.
Thank you. I'll close this out very briefly. Thank you so much to everyone for being here. Thank you for your insightful questions. Thank you in advance for telling your friends and family to watch this film. Thank you for supporting us at CCS. You're all very thoughtful. You're generous. We're immensely grateful to you. We're immensely grateful to you, our panelists. Thank you for creating the film. Thank you for taking the time to talk to us today. Just thank you. In the chat, we've again popped up one last time the link if you'd like to donate, and then also we'll put up a link there if you want to get involved. If you want to send a letter to your representative, if you want to see other ways that you can help, we'll put a link for that as well. And I can see that you just popped up a link to the to where you can go to find out where you can watch it. So again, just thank you. And I'm moved. I hope everybody else is feeling moved as well. Okay, thanks very much.
Bye, everyone. Thank you.
Thanks, everyone. Should we leave?